Okay, great. Thank you guys for your patience and for spending a few minutes in the waiting room today. We were working out some technicalities with an automatic translation tool that we're using for the Patient Engagement Open Forum virtual sessions. So thanks for your patience. Happy to have you with us here today. So my name is Nicole Wicke. I'm a program director with PFMD, and happy to welcome you to this special Patient Engagement Open Forum session today. So the Patient Engagement Open Forum virtual sessions, of course, are an avenue to bring together patient engagement champions around different topics and projects in patient engagement, really bringing a holistic perspective and multi-stakeholder perspective, fostering collaboration, and looking to make great progress in patient engagement work. And today we're testing out a new format, so a 1-hour session on called a Lunch and Learn. So we'll try this out together today. So this will be slightly less interactive, but of course we do have a Q&A within the agenda of this session today. So, so we'll still be able to hear from all of you. I'm just going to post a link in the chat. We do have live translations available. So you can follow that link there. If you want to follow along today in another language, feel free to try that out. So the link is there for you guys in the chat. And then on the next slide, just recap. This is nothing that's new to any of you that are regular attendees of the Patient Engagement Open Forum. But of course, we're happy to have you here today, be present and engaged. All of your microphones will be muted. We do have a Q&A at the end of the session. So if you have specific questions for our great panel of experts that I'll introduce shortly, please use the Q&A function for that. And of course, the chat's freely available. So put comments, feedback, chat with your colleagues through the chat. So, and as always, this session is being recorded and it'll be available on the PFMD signups, Patient Engagement Open Forum page for the event shortly after the session. So without further ado, we can get started. So today we've got a really packed agenda, but we will get through everything. So we're going to start with a bit of an overview of the general rules of engagement when it comes to patient engagement with pharmaceutical companies in particular. Then we're going to talk about national trade associations and their codes of conduct or codes of ethics, and also talk about the patient engagement country guidelines, an initiative where we're developing some quick reference tools for patient engagement partners at PFMD. And we're also going to explore a couple of examples of codes of conduct and national associations before we then take some time to speak with hand things over to all of our speakers today and have a bit of a panel Q&A before we wrap up. So I'm really pleased to introduce our speakers and our panel for today. So maybe we can start with Sarah Davies.
Hi, thank you, Nicole. Really good to be here. Thank you very much for the opportunity. So I'm Sarah Davies. I work at Lunch&Learn, which is a consultancy. We work with a lot of pharmaceutical companies on patient engagement projects. I've previously worked in-house for pharmaceutical companies, but I've also worked for patient groups in the UK. So I really feel I have experience and the perspective of both of different stakeholders within this, and really looking forward to the discussion. Thank you.
Hi everybody, my name is Helen Finden. I work with Sarah at Lunch&Learn. I've been working with Sarah to produce some of the country cards that Nicole just referenced. So in terms of my patient engagement experience, I used to work in the NHS for a specialised service, and I sat between the clinical team and the patients, facilitating interactions, making sure the patients understood what was happening to them, the treatment decisions that were being made, and also helping them with interactions with pharma.
Then maybe over to you, Andrea.
Yes, thank you, Nicole. Hello, everyone. Very nice to see you here. My name is Andrea Krokutz, and I work for GCO Global. We are your experts in consulting and executing impactful compliance stakeholder interactions. I have a very particular interest in the patient engagement interactions between pharma and patients organizations. And I'm very excited to be here today and discuss a bit more about how we can leverage the patient engagement guidelines that we've been developing in partnership with PFMD. Thank you.
Sarunas?
Hello, my name is Sharunas. I'm a patient advocate. I hope you're, because I still see Nicole. Yeah. So I'm a patient advocate based in Lithuania, living with rare type of blood cancer for 18 years now. Been involved in all kind of activities in patient engagement. I'm a co-founder and chairman of Youth Cancer Europe. I have also founded the Lithuanian umbrella organization, Lithuanian Cancer Patient Coalition. Have been working with PFMD on the topics that we're going to be discussing today. Talk more later.
Thanks, Sarunas. And Julie?
Yes, hello. Thanks for inviting me. I am Julie Bonhomme. I work at FPA. I am in charge of legal affairs and compliance. So I am the support of the FPA patient think tank on various projects, and I am really happy to be here to introduce the rules applying to interaction between patient and pharmaceutical industry.
Great. Thanks. Thanks, Julie. Thanks, everyone. We're happy to have a great panel of speakers today. So before handing over to Julie, I can just introduce myself once again. So I'm Nicole Wicki. I'm involved in this session today because I'm driving a lot of the work within PFMD on legal and compliance and fair remuneration. So I'm happy to join this great group of people today. And so over to you, Julie. You can talk us through and give us an overview of the rules of engagement to kick things off.
Thank you. Can you go to the next slide? So just to start with the law, because you know that in relation to interaction with patients, you have legal provision and self-regulation provision. I will start with the law. So as you all know, on the top, you have the EU directive at European level. You have all the European directive or regulations that are really the highest standard possible, and all other standards need to comply with this overarching directive or regulation. So then, if it is a directive, it is transposed in national legislation. And then based on that, the FPA code say that you need to transpose the FPA code with the European code of practice into national code, but align with national law and regulation. So you have this kind of visual explanation. So can you go to the next slide, please? Thank you. So on the legal provisions themselves, for the pharmaceutical industry and the patient interaction, we are in the Directive 2183, which also include other provisions, but regarding interaction with patient and patient organization, they are not mentioned. Unfortunately, there is nothing about patient or patient organization or expert patient or anything. Therefore, all the provisions applicable for patients are the same as the one for the public. And what is really key is also to know that you have a lot of stricter rules applying to promotional activity. So what is promotion from the directive is when you try to when you want to have your medicine prescribed. So this is really defined in a way in the directive that I have reproduced. So you have really a distinction between promotional activity and non-promotional activity. But what is key here to understand is that you cannot promote your medicine to the public. So you cannot promote your medicine to the patient. Can you go to the next slide, please? Thank you. If you go to the FPA code, the FPA code include a recognition of this interaction between pharmaceutical industry and patient organization first, and then in 2019, we also include the patient organization representative. So we define patient organization and we define patient organization representative, but here it's really something in addition to the regulation. So we want here to highlight the fact that we have interactions that are legitimate. Can you go to the next slide? Yes, thank you. So in the FPA code itself, you can have different type of interaction. You know them. You can have, it can take the form of donation and grants, but only with the purpose to support healthcare research or education. You cannot do a donation for something that is not related to the objective of pharma industry. You can have sponsorship for organization of event, for example. You can also have contracted services if you ask services to a patient organization or a representative of a patient organization. What is really key, what is really important, the principles that apply whatever the type of interaction is that the company cannot require to be the sole founder or sponsor of an organization. Either if it is a healthcare organization or a patient organization, this is really a key principle. And maybe what I should say here, and sorry for not mentioning before, of course, the FPA code is the code that pharmaceutical company commit to apply. So all the rules I mentioned apply to pharmaceutical companies. They do not apply to patient organization, but this is rules applicable to pharma company for their interaction with patient organization. So what is really important is to not ask you to be the sole founder. So sometimes it happens that you only have one founder of an activity. It's okay as long as it was not required by the company itself. So of course, the principle behind that is to welcome a broad funding and sponsorship. And then also when we include patient organization in the code and representative, all the other provisions apply. So for example, all the rules applicable to event and hospitality. So event is, for example, you sponsor a congress, are applicable to patient organization, and also the gift prohibition apply to patient organization. Can we go to the next slide, please? I will try to speed up a little bit. So the specific requirements that apply only to patient organization are first the transparency principle. So what is really important is that the public knows, and anyone interested knows that you had an interaction with the patient organization. Also to maintain the independence. So here it is drafted for patient organization. So we want to maintain the independence of a patient organization. You should have mutual respect, but I think it's the case for any other interaction. No promotion of a particular POM. POM is prescribed only medicine, sorry. And again, transparency is a key aspect. So it's not disclosure, it's different. It's being transparent about the interaction. It's not publishing the value, but it's being transparent about the interaction. For example, if you pay someone for drafting a blog, this should be mentioned in the blog itself. Then you must always have a written agreement when you ask support to patient organization, and you cannot influence the text written by a patient organization. If you sponsor, you cannot influence the content. And please, I think this is my last slide. Yes. Well, why all these rules? So it's not to make your life difficult, as I always say. It's to protect the collaboration, and also to demonstrate the legitimacy of the collaboration. So when you pay, when you provide a payment to a patient organization, you have a legitimate purpose, and there is a reason behind to give this money. So this protect both parties, to have this legitimate purpose. Also, what is really key is we cannot promote medicine to the public, so we cannot discuss promotion of of a medicinal product with patient organization. This is one basic principle of the directive, and we need to comply with it because it's a really important issue. And here, so what is the mission of legal and compliance in general? So it's not to make your life difficult, but it's to secure the collaboration, to reduce the risk, and to try to find the best way for the collaboration, because it's always really legitimate to collaborate. And can you go to the next slide, please, the last one? Here, it's all the resources you can find that were drafted with the support of the with the FPA Patient Think Tank and the support of the FPA Ethics and Compliance Committee. So first you have the code of practice, but you also have guiding principle on different topics, and you also have a really good guidance from the International Federation of Pharmaceutical Industry. Thank you. I think that's all for me.
Thank you, Julie. Now over to you, Andrea.
Thank you, Nicole. Thank you, Julie. That was very interesting for us to understand a bit the context of how FPA operates. And to make this a bit more interactive, we have a question for you. We can move into the slide with a question. You can scan the code and you can pick one of the options that you think it's suitable for you. So the question is, we just want to understand how familiar you are with your own country pharmaceutical associations and their code of conduct or code of ethics, depending, the name can be different. So if you can please scan the code and let us know. We have quite some interesting percentage. We are still waiting. Okay, this is interesting. So indeed, we can see that, of course, the majority is familiar with both of them, which is normal, because otherwise maybe you wouldn't have joined this session. But I'm happy to see that there are also attendees that maybe they're not so aware of what a pharmaceutical association and their code is. So that's why in my session today, I will explain a bit more the basics, or like the main information that will help you navigate and will help you find out where you can find the code and what a pharma association in your country means. So I think we have enough information about the percentage. Now we can move to the next slide. So I'm gonna be talking a bit about the overview of pharma national trade associations. Pharma trade associations are organizations that represent the interest of pharmaceutical companies within a specific region or country. And they exist to provide a unified voice for the pharmaceutical industry, to promote the best practices and advocate for policies that support the innovation and access to healthcare. The pharma trade associations play a very crucial role in shaping the healthcare policies, the collaboration among the industry stakeholders, the healthcare professionals, the patients, and also advancing in the interest of patients. As we can see on the current slide, pharma trade associations can be organized at global, regional, or national level. Of course, they all represent the interests of pharmaceutical companies within their respective regions. And one of their main roles is to serve as a platform for the industry networking, knowledge sharing, and advocacy of issues affecting the pharmaceutical sector and their stakeholders. They can also facilitate a dialogue with their regulatory bodies and promote ethical business practices that will, of course, serve the interest of patients. And they also provide resources and support to member companies, such as training programs or regulatory guidance and market insights. They can also answer questions in case you have doubts on the guidelines that are included in their codes. Therefore, they really play a crucial role in setting up the landscape for interacting in a compliant way with healthcare professional, patient organizations, and patients. By representing the pharmaceutical industry, these associations help ensuring that the pharmaceutical sector operates in a transparent and responsible manner, ultimately, of course, benefiting the patients and the healthcare system. We can move now into the next slide and have a deep dive into the national codes of conduct. Each trade association operates by a set of guidelines and principles that govern the behavior, the roles and responsibilities of their member companies. So these guidelines and rules are incorporated in the code of conduct or code of ethics of each association. For example, in this slide, I have included a list of the FPA members that they have their own pharma association and a code of conduct or code of ethics affiliated with them. The guidelines of the national codes of conduct, they outline the ethical standards and best practices for interaction between pharmaceutical companies, healthcare professional, patients, and patient organizations. And by following these industry codes, the companies, they demonstrate their commitment to a higher ethical standard, and they protect the patient's interests, promoting a responsible engagement between their stakeholders. Some key components that we might find in a typical code of ethics or code of conduct might include guidelines related to compliance with laws and regulations, because some of the countries might have law in place, which sometimes could be more stringent than the code of conduct. Therefore, the members are expected, of course, to comply also with those laws and regulations together with the code of conduct. Another key component that we can find in a code is transparency and disclosures. Of course, it's very well known that members should disclose any financial relationship that they have with their stakeholders, either healthcare professionals or patient organizations or even patients. Of course, the patient safety is very important. So the code always includes some guidelines about prioritizing the patient safety and the public health in all the aspects of a pharmaceutical company's activity. Also, the fair competition is very important, as members are expected to engage in a fair and ethical competition, respecting, of course, also the intellectual property rights of all the other stakeholders involved. We can also find key components of data integrity and scientific accuracy, because members should ensure the integrity of data and the accuracy of the information that is communicated, of course, to their stakeholders and to the general public, of course. And it's also a commitment of continuous improvement and continuously reviewing and update on practices to ensure, of course, compliance with the evolving landscape of the ethical standards. For example, the FPA disclosure code, they require, of course, the member company to disclose the payments of transfers of value made to healthcare professionals and patient organizations, which shows that indeed they're promoting transparency and accountability. So that is why adherence to this code is crucial for fostering a culture of integrity, transparency, and making sure that all the interactions are driven in a compliant way. This will lead me to the next slide, where I'm going to introduce a bit the patient engagement country guidelines. One of the biggest barriers to greater pharma and patient collaboration is of the uncertainty about what is permitted by industry's code of conduct and whatnot. Therefore, when engaging with patients' organizations or patients, company might hesitate to take the next step if they're not so clear about the local rules and responsibilities that apply when interacting with a patient organization or a patient. We have noticed that most of the countries, they have in their ethics code guidelines for interactions between pharma and healthcare professional and patients organizations. However, there is often a lack of clarity when engaging with patients directly. That's why this can lead some organizations to be more cautious in engaging with patients, even though they value the patient insight, and that might contribute to their purpose too. That's why the patient engagement country guidelines was developed in collaboration with PFMD. So we at GCO we're very happy to be involved in this project alongside PFMD and share the same purpose and vision. And the purpose of this PE country guidelines is to address these key issues when the industry is planning to engage with patient organizations and patients, such as remuneration, payment of expenses, hospitality, any possible conflict of interest that might appear, and the transfer value reporting whenever this is required. Crucially, the patient engagement country guidelines, they offer country-specific information based on national codes of conduct, which make compliance clearer, let's say, for companies. At GCO, the first country that we have been developed so far in collaboration with PFMD were Belgium, France, the Netherlands, Romania, Switzerland, and Spain. And we are very curious to hear also later from you in the Q&A session if you have maybe other countries that would be of interest in Europe. And of course, we are very driven by the fact that I think all stakeholders involved in this project, we value the patient groups and their insights, and we aim to support sharing the knowledge and experience. So that's why we are very thrilled to be involved in the patient engagement country guidelines development. Thank you very much for listening to me. And then if you have any questions, we can have a Q&A session at the end of the session. So now I will hand the word to Sarunas.
Yes, hello. So I was asked to comment a bit from the patient perspective about these national country guidelines. I have just 2 slides to speak on, but please feel free to engage me during the discussion later on. So actually, there will be in the next slide the link, but don't go there yet, the QR code to scan so that you can yourselves see those country guidelines. But this is actually something very easy to read. It follows the traffic light system, meaning green is that this is allowed in a country, red definitely not allowed, yellow either there is nothing specific mentioned or it's the gray zone. And there are these 4 different parameters. So I would say the fields of interest reflected in these national guidelines: remuneration, reimbursement of expenses, hospitality, transfer value reported. And both of them apply to the patient organization or the individual interactions with patients, carers, or caregivers. You know, we can't even define with one term how we call people nowadays. But what I would add to this, so of course these resources are very helpful, I would say, as a starting point. To me, it is relevant, but it's just you know, brushing the surface, because remuneration is okay. Are you allowed to pay? But the question you should be asking, how much, what's appropriate, what's not appropriate, and you know that the engagement is not overpaid or underpaid, and that you know, demands the more granularity. This is where national guidelines are not going to that extent. There's other tools to do that. And specifically, I could mention this one exercise that I was collaborating with PFMD, where we created not just global guidelines that were aligned between the patients community and the industry, what's good, what's not, in terms of these fields, but also we're working on a calculator. What is the fair market value in a specific markets? So reimbursement of expenses, again, it is if it's allowed or not, but again, it's to me just brushing the surface, because from the patient or patient organization point of view, it means, you know, what documents you need to submit and how long you need to wait for the reimbursement to arrive, whether you can, you know, buy the tickets upfront for the representative of patient organization or you can't. And from the corporate point of view, for you guys, most of here coming from industry perspective, you don't care about it. But I can tell you that it may mean that you know, the patient may not be willing to engage with you if you are if she does not have the means to buy the ticket, buy the hotel, you know, upfront, and then to wait for half a year to receive something. And so you also need to be, I think, you know, put yourself in the shoes of who you are inviting, the underserved, underrepresented populations, and think of what could be the barriers to that engagement, even if they want to contribute with the knowledge and time, but there are other aspects that could prevent them from doing so. hospitality. So it's more about, you know, the venues you stay. Are you staying into, you know, 3-4 star venues, or in the all-inclusive resorts that has casino, which is definitely not allowed. So it's also a fine tuning, and this is where actually national country guidelines are helpful. I wouldn't say that there's much more to discuss in granularity apart from that. The transfer value reporting, it's again based on the regulations, which mostly not coming just from the self-regulation of national associations, but mostly by the laws as they are adopted at the national or local level. And here we can go to the next slide. You will see these are the number of countries which already have the guidelines available that were developed with the group who's on this call. Press the link, and this is actually I think it's uploaded on Synapse, these guidelines. I just saw the chat. And comment in the chat if you know, the group should focus on other countries which are not included yet. So while this resource is really good, but I would also want to draw your attention to other resources. I'm not sure if Nicole has them at her fingertips to put it up, like this guidelines that were created at a global level for the engagement with patient communities, so patient organizations and patients. This is, I would say, a very comprehensive work. And there's also this fair market value calculator as not one which is very specific, which was done in US, and which is more difficult when you go to all of the European markets and broader, but still it has a lot of parameters to discuss. So I think, of course, is just a crash course what we are discussing today. But if you're interested in the topic, I can assure you that right now there is much more content available than you would think, and it's not abstract, it's not principles, it's something very specific, and going into, you know, how you should be interpreting certain clauses in this code of conduct by the pharmaceutical company at national or international level. And what I want to leave you with is that I would challenge you to think, when you are looking into these national guidelines, whether they were co-created with the patient community or whether they were just exercise that, you know, was done in-house with the association or just industry partners. Because yes, on one side, as you know, was the presentation in FPA concept that you FPA is not governing everything. First comes the directives at national level, it comes laws or bylaws, and then there is a self-regulation element. But even with that, there is a lot of things that may go wrong and prevent you from engaging patients if it is not being done in discussion with the patients. And so this is the part where I have been engaged on these topics for the past decade. And I think we made tremendous effort. We are much better aligned as industry and patients community now when we were a few years before. This is when you look into the country guidelines. So if you will be asking, okay, have these national guidelines summarized in this exercise, what I would personally want to see if they're saying yes, we co-created with these patients, or we just think that we get it right, because some part of, you know, peer review is needed, and peer review is not when just industry reviews itself. So here I pause. Thank you.
Thanks for that, Sarunas. And I'm going to hand it over to Helen and Sarah at Lumanity to talk us through a couple examples, and Andrea will wrap up with a quick mention of some small technicalities in the Netherlands. So over to you guys.
Thank you. Thanks, Nicole. I'm going to start, and I am going to start by saying it is really complex. And there is a lot of guidance out there. There are a lot of gaps still. So please just don't let that put you off. I think the idea and the objective behind having these guidelines is to really help you and to give you a starting point to signpost you to where you can find more detail. We're just going to look at some examples, as Nicole said, of what we found when we were researching the guidance and looking at what was available in different countries. And it does vary very widely. So some countries have a lot of information, which is relatively easy to find and clearly presented. Some companies do even have remuneration rates set for working with patients. And generally speaking, where there is a strong national association with clear guidance, so like the ABPI in the UK, it does lead to more confidence around how to manage collaborations. But some countries do have very little guidance, which can create some uncertainty and confusion. And hopefully that is where the guideline cards can help. If we can go on to the next slide, please. So looking at India and the UK, these are two examples at different ends of the spectrum. So in India, there is very, very little guidance specifically about interactions with patient organisations by companies. And in situations like that, you've heard a lot today about the different rules at sort of FPA level or international federation level, and then also legal guidelines. So we would suggest that you do need to look at both the legal guidelines in your local country, and then also if there are no specific guidelines from a local national association, then look at FPA or the International Federation to give you some idea of the direction that you could be taking. And then on the UK, as Trishna commented in the chat, yes, so the ABPI is very well established, the ABPI Code of Conduct, and it has set up a separate independent body, the PMCPA, and that was actually set up in 1993, so it was established sort of 30 years ago. So it has a lot of clear guidance. You have the actual code, but then the PMCPA also publishes additional guidance. So if you're looking for more detail on how to interact, it includes a lot of information. And they also publish what are called code cases. So if there have ever been any questions or investigations into a potential breach of the code, the PMCPA also publishes that as well, so that you can see how they're judging activities, and it can really help to steer you in the right direction. And the other thing the ABPI also has is it has a patient organisation forum. So it has set up a group where it brings together member companies and patient organisations and other stakeholders to continue to discuss ways of improving processes. So even though to many the ABPI and the PMCPA might seem to be the ideal situation, I think they recognise that there is still room for improvement, and it's such a complex area that whatever your collaboration, it's very rare that it's a very clear-cut, simple process. Often it does require discussion, and these collaborations also do take time for everyone to agree what's appropriate and how to manage them. So I'll turn over to Helen, who will just talk through the process. And Helen, I would say, has done some of the hard work, a lot of the hard work in developing the country cards, but hopefully it might help you if you're looking to do collaborations in certain countries.
Well, thank you, Sarah. Thank you very much. Yeah, so as Sarah says, I'm going to talk through some of the things that we noticed as we're developing the country-specific patient engagement guidelines that might help you as you navigate and use them. So first of all, we noticed that guidance often comes from a variety of sources. And so it's important to check and cross-reference and consider those sources when you're interpreting and applying the guidance to your partnerships to stay compliant. So, for example, Japan has the Japan Pharmaceutical Manufacturers Association, and as part of their larger code of practice, they publish transparency guidelines for relationships between pharma and patient organizations. Also in Japan, the Agency for Medical Research and Development publishes a separate patient and public involvement guidebook. And in terms of the parameters on the cards, neither resource covers everything, but using both will guide those transparent and productive interactions that we're looking for. Other examples of countries where there's more than one information source include Brazil and also Australia. And specifically with Australia, I think the reason why there's such a variety of resources is because actually there are regional variations in the guidance. So Medicine Australia has published guidelines in collaboration with health consumer organisations, but the specifics in terms of the parameters of the PFMD patient engagement guidelines vary. So in Victoria, for example, remuneration rate guidelines reference wider government appointment rates. And so I think in this particular example, the PFMD patient engagement guidelines are really just so useful for signposting people to those to the sources of information that they need to look at in order to make their decisions. I'm moving on to the third point now. You might have just heard me say health consumer in Australia. And so this third point is around terminology and language. I noticed when researching the cards that the term patient engagement is not always the preferred term. So in Australia, the term consumer engagement is more common, and that includes people with lived and living experience of health conditions, and it also includes carers and family members and supporters. So it's just another example, another important point to be aware of when navigating this, as Sarah said, this very complicated, complex landscape. And then the last point on this card is those grey areas that you heard about earlier, or the amber traffic light part of the system. So there's lots of places where the guidance perhaps isn't very clear, and those gaps can be difficult to bridge. Similarly, you've just heard about the UK, for example, where there's lots of very comprehensive information. And perhaps you might wonder if you found it all, do you have everything in front of you that you need to make those good partnership decisions? And so we'd say that where there are questions or uncertainties, there are places to go to for further information. We heard from Julie earlier, and we've got the FPA and IFPMA guidelines that can be used to decide on compliant ways to interact with patients, patient organisations and pharma. And of course, the PFMD cards themselves. And as Sarah alluded to, we just would like to flag again that those local legal requirements are very important to consider as you progress with your projects. So if we move on to the next slide, we can just see, jump back to India, where there's very little information available about patient engagement. There is a code of marketing practice for pharmaceutical companies. It includes information for interactions with health professionals, but no guidelines for engagement with the public or patients or patient organisations. There's a draft set of guidelines in place for medical device marketing practices, but again, no patient engagement specific guidance is in there. And when researching India, it reminded me of that quote, absence of evidence does not mean evidence of absence. And so when I was looking for the information, I was concerned that, gosh, I can't find it. Does that mean that it's not there? So I think for users, being confident that you found all of the information takes time. And again, that's where the patient engagement cards, PFMD, FPA, and so on, are really helpful, because you can go back to those sources and gain clarity and direction. So I'll move on now and hand back to Andrea, who's going to talk about those Netherlands specific examples. Thank you.
Thank you, Helen, and I will try to keep it short because I'm very conscious of time. So when we were working in it for the country guideline of Netherlands, we noticed that the Code of Conduct of the Netherlands and the CGR Code of Conduct, it's quite comprehensive. They cover a lot of guidelines for certain situation when engaging with healthcare professional and patient organizations. However, we noticed that the interactions between the industry and patients or caregivers that could be contracted as individuals are not explicitly covered by the current code. However, they do have an explanatory notes document that they outline different roles that patient can play in the interactions between patient organizations and industry. In the explanatory notes, it is mentioned that these categories have been set up as per the National Patient Federation guideline that regulates the interactions between patient organizations and pharmaceutical companies. Again, they don't make reference that patients can be engaged as individuals. However, because we encounter here this term of experienced experts, the question that comes up is, ultimately, can we contract, let's say, a patient as individual or not? Also, in addition to this information, the code of conduct, they do provide like a breakdown of the fair market value that could be offered for certain categories, like healthcare professionals, nurses, patient organization representatives. And we have seen that the patient advocates, for example, they could be fitting into the other category. So that guidance is quite clear in the sense of how much they can be remunerated per hour. And then we had to investigate a bit more to understand if the experienced experts can be remunerated with the same hourly rate or not. So indeed, it took again a bit of a research, and we understood, or to our understanding, the explanatory notes, they do make reference that experienced experts can be, let's say, categorized as a bit lower hourly rate than a patient advocate. And that has been set up as an example where the Code Commission has ruled that a total reimbursement of 75 euros an hour, it would be fair in a specific context when an experienced expert is engaged. So we just wanted to emphasize here that sometimes, even if a code is very comprehensive, the interpretation can vary depending on who is looking at the code, where we are looking. Of course, sometimes there could be multiple documents that are attached to the code itself. So we just have to be mindful that it's a, let's say, a complex landscape, and several interpretation can come up while looking at the same document. That was indeed our finding for the Netherlands. So I'll hand this back to Nicole. Thank you.
Thanks, Andrea. Yeah, you can see how it's not really, it's not always very straightforward, but on the other hand, but this isn't it doesn't mean that patient engagement can't happen. It's just about how it can happen. So as we've convened some really great ethics and compliance experts here today, we'd like to open the floor to some questions from the audience. So we have a few queued up in the Q&A. So our panel today are able to address some more broad questions around ethics and compliance, the role of national associations and self-regulation codes. So we might not be able to address highly specific questions because, as you've learned today, not all questions around ethics and compliance have really straightforward answers, especially when we get into the finer details on a local level. So, but if we can't address your questions live today, since we just have 10 minutes left, for sure we can connect separately to put you in touch with the right people. Or if there's additional questions that come through the Q&A that we're not able to address, we'll just add those into the slides, and the slides will also be uploaded together with the recording in the Patient Engagement Open Forum event page on signups. So, so if there's something that you'd like asked and answered and we don't get there, don't worry, we'll make sure that you get the information that you need. So there's a few questions in the chat, but maybe just to kick things off, I have a question for Sarunas. So for Sarunas, as a patient advocate, and especially through your work on a pan-European level, working with Youth Cancer Europe and across all of Europe with all of your different members and contributors, can you maybe really briefly summarize a couple tips for patient organizations in navigating those different national codes of conduct? Now, what would be like your two hot tips that you could offer?
Yeah, so for one tip actually is for counterparty in industry to be aware about the FPA codes and about the initiatives that were done in co-creation. Why I'm mentioning FPA codes? Because FPA codes were reviewed by patients, and I'm a member of this FPA patient think tank. And the resources that were shown were actually co-created with patients. So when I say co-created, it's not a tick box exercise, meaning we fight that we don't like something, or the wording is weak, or something does not make sense. Like there was fair market value point that came up in chat, because often in my experience is that the person from the industry that we engage, and let's say we want to have patients involved, they may not be aware of all of the limitations of what could be possible and not possible. And it is paradoxically to me that we are not professionals, we are not working in industry, we're supposed to know all of your bureaucratic rules, but somehow we know it better than the people who are engaging us. And when we pinpoint to the resources which are available, then we can smoothen the conversation exactly about that. It's mostly about the time which is being lost clarifying something. So can you pay the person this and that if they're coming from 10 countries? Can we get this venue or not? What about the travel? What about the freeway travel? Okay, what I mean freeway travel is imagine a patient is coming to your event from a conference and then going back home. To your compliance officers, it's like error. How can you do that? How can you go to a different place where you're coming from? And when we're asking account for reality, we are not going to go from the conference to our home country so that we could fly for a 2-hour ad board, flying 6 hours and then be paid for 2 hours and going back. So all of these things need attention. It's not a fight, but it both. I think time is important to be respected. And if we think of the time that the commitment takes, and we start that discussion early on rather than receiving the contracts just before entering the room. I can tell you so many times it happened. I can also tell you that it's not acceptable to me right now. There were instances that on principle, I refused to sign it when I was handing it, just, okay, sign this and then enter a room to advisory board. I said, even if I agree with these provisions, you do not respect me. You did not ask for my input, whether it's acceptable. I don't accept and I leave. Of course, we don't want that, but it's like sometimes it takes this to showcase that we demand respect when engaging with industry as a patient organization, as a patient advocate, as a patient expert, as a lay patient. I stop here.
Mm-hmm. No, I think that's really interesting points that you raised there, Sarunas. And I think that's where it's important to really, like our partners from Lumanity and GCO were stressing that although it might be cumbersome to have to look in more than one place, some of these different finer details of interactions and the reality of interactions, especially when you layer on travel and other considerations, they're often not outlined in the codes. But we do have guidance from FPA, co-created guidance from initiatives like PFMD, where we have found consensus around some of these points. So there's some nuanced details, but it gives some of those guiding good practices around patient engagement. So bringing all of these things together can really help partners to have those conversations to set up engagements in the right way. So, Sarah, I see that you've got your hand raised.
Thank you. I was only just going to add, I'm not saying it's right, but I think one of the challenges is that often the processes and systems for companies have been were originally set up for HCP interactions. And that's why there's often a lot of tension, because it doesn't really take into account the different situations and the different needs when you're engaging with patients and patient organizations.
Yeah, thank you. That's a good point.
I actually have one quick tip, 30 seconds of this time. Look if your agreement that you are sending to the patient organizations, etc., includes the clause that they should report pharmacovigilance within 24 hours. If that's the case, that means this agreement was not adapted to the patient community. You just copy-pasted what you use for healthcare professionals, because this is not applicable to the patient community.
Yeah. So there's a question in the Q&A that I'd like to bounce over to Julie. This one came in quite early on. And this is about the FPA code and how this is quite focused on patient organizations. And the question here is alluding to, where does FPA sit in terms of its guidance and where the code is when it comes to individuals, individual patients or advocates, patient experts, so other participant types rather than just contracted patient organizations. Maybe you can just comment on that.
Thank you, Nicole. It's not an easy question. And coming back to the previous comment, and I am really sad to hear that, because I think, this interaction between patient organization and pharmaceutical industry is really key for healthcare, so the global healthcare. And so I think we need to better understand each other. It's true that probably they sent you contracts that were first made for healthcare professional, and it's not good. So yes, so I am really sad to hear that, because I think that yes, it's a pity, and you know, it's common rules, you know. It's not we should not look into code provision when it's about reimbursement of travel, and it's true that we can understand that you will not go back always to your house. So bref. And so on individual patients, there is nothing in the code, because due to the fact patients are addressed in the recital of the directive. The recital of the directive are not the articles themselves, it is the introduction of the directive. And it's really about, and I'm sorry for that, and I'm sorry to tell you that if you are not aware, it's really that all the interaction is made for medicinal purpose, so for promotional, and that only healthcare has the healthcare professional have the scientific knowledge, you know, to be able to receive this information. So this is the reason why today it is illegal to have interaction with individual patients. Of course, this is what is written in a text, and then in the reality, we do differently. Like, for example, it was mentioned in the chat earlier, in rare disease, where you have no patient organization, of course, in that case, company interact with individual patient. So you have exception to this rule, but it's just to explain to you why is it so difficult for pharmaceutical industry to have interaction with individual patient. I hope this answers the question.
Yes, thank you, Judy. I think the working together with patients and patient organization guides really helps to supplement that. So
Yes,
it's
and
not formally in the code, but FPA has provided its members some guidance there. So.
And it's so sorry, I will finish with that. It's always how you will explain, you know, in case someone asks you, a media, your family, a friend, I don't know, politician, how you will explain this interaction. So if you are comfortable with the collaboration you put in place, even if it is with an individual patient, if you feel that you have a rationale behind, then you can make it. You know, it's also how you feel and how you are able to explain it.
Great, thanks, Julie. And we have come to the end of our hour, which went very quickly. I hope you've all enjoyed your lunch during this great presentation and discussion today. So in our pilot of the Lunch and Learn, we might need to have an hour and 15-minute lunch break for these sessions. But I have noted some really exceptional questions in the Q&A. And so as I mentioned, we'll just add these into slides at the end of the presentation from today, make sure that we've got some really nice comprehensive responses for you guys and point you to some different resources that you can find. I'm going to post a bunch of links in the chat right now for you all. One of them includes a feedback survey. So it's just general feedback on this PEOF session today, but also there's a question in there to ask for any recommendations on what countries we can work on next with our partners at Lumanity and GCO for those patient engagement country guidelines. And I strongly encourage you guys to check them out. They're very simple, quick reference resources that just point you in the right direction. So really, where do you need to look in the code when it comes to certain things? Where can you find more information? So we really look to signpost you guys to whatever is available within that particular country, including additional resources. So you'll find the FPA, if it's a European country, FPA links there, IFPMA and other PFMD or a National Health Council or We Can resources that might be relevant. So please check them out, give us your feedback, and we look forward to seeing you soon. Please be sure to check PFMD sign-ups and register for some upcoming patient engagement open forum sessions. So we do have one on different dimensions of patient matchmaking on the 19th of March. There's also a great session on precision medicine value assessments and integrating patient experience into those assessments. That's on the 4th of April. And also a session on the 25th of April focused on the Gravitate Health European project, looking at the project's patient engagement strategies. So we look forward to having you with us in those upcoming sessions. If you have any additional questions at all, please feel free to email me and reach out. And thanks for joining. Thank you to our very amazing panel for their presentations and their time today. So thank you all and have a great rest of your day.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thanks. Take care.